Hello, everybody. Dr. F. Scott Field here, and I'd like to introduce you to our newest sponsor. The NPTE Final Frontier is the review course that I wish was around when I took the board exam. For those of you who know my story, it took me a handful of times to pass that exam, and quite frankly, I really wish I had an exam review course around, just like the NPTE Final Frontier. Check out their website, npteff.com, and use the code HET at checkout for 10% off to all of our listeners and fans. Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I have the pleasure tonight of being joined by somebody that I get to work with on a relatively regular basis. She teaches with me at the University of St. Augustine, and I am thrilled to get to finally bring her on and talk about all things student loan debt crisis. It may seem like a topic we've been covering a lot lately, and that's mostly because it's that important. And we're trying to get as many experts on as we can to cover, just what's going on out there with the student loans, how we're going to attack them, what the issues are, and just get people thinking about it, get people talking about it. So I have with us tonight Dr. Madeline Ratoza. Madeline, tell us a little bit about your academic journey and how it led you to where you are today.
Sure, absolutely. Well, I graduated 7.5 years ago from UCSF, San Francisco State University in San Francisco, California. And as a public in-state institution, I graduated with over $200,000 in student loan debt. And I've been practicing. I practiced for 6 years in outpatient, inpatient, home health for geriatrics, pediatrics, and general practice sort of across the board. I had about 5 full-time jobs in the course of 6 years, and then made my way into academia. And I've been working as an instructor at ACC at the University of St. Augustine for the last year and a half, full-time. I started a little bit before that as contributing faculty. Also am a PhD candidate at Texas Women's University, so studying health services research at this point, but have done a couple projects in student loan debt and financial literacy sort of along the way.
Yeah, I mean, again, it sounds like we're beating a dead horse here, but the reason that we keep coming into this and talking about this topic is because it is a major problem, and we don't have the answer yet. I would say I think at least there's an awareness enough that we know it's a problem and we're recognizing it. Right? We've hit the admission stage. Like, hey, we admit there is a problem, so that's good. Right? We're there. But now we got to come up with the solutions, I think. And one of the things that you and I had the privilege of presenting on when it came to financial literacy up there at the Educational Leadership Conference in Milwaukee was this is a multifactorial problem. It's not just one issue. It's not just the cost of school, So why don't you dive into a little bit about that and kind of tell us about some of the different factors that you think kind of feed into this problem?
Sure, absolutely. So when we think about the problem of debt and physical therapy, it's really a problem related to the debt to income ratio. So how much money you come out of school in debt with versus how much money you're making. And your debt to income ratio includes your student loans, but also includes your living expenses, your car expenses, etc. And when students take out loans, and this was the case for me, absolutely, when we take out loans, it's not just for our tuition, which for me wasn't that expensive and comparative. It's also for your living expenses. So I was living in an expensive city. Just rent was over $1,000 plus traveling for clinical education, etc. And so the total cost ends up being quite a bit. But what the real kicker, I think, is the interest rate related to your loans. So when I graduated, it was my average interest rate across, I had to think 14 specific individual loans with over 7% of interest. And that's not even as high as it can get. And so it's one thing to pay back $200,000. It's another thing if you're on a 10-year plan with 7% interest for $200,000. It ends up being even if you paid off in 10 years, it's something like $378,000 or something like that. So that really increases the burden for student loan debt and is a problem in higher education, not just in physical therapy, but across the board because we are not able to get subsidized loans anymore for our education.
Yeah, it's pretty wild. I mean, if you think about it, right? If you get locked in at the wrong rate and you just, like you said, are paying it over 10, 15, 20 years, you'll never get out from under that that snowball, right? That thing will just keep growing and growing and growing if you just keep kind of throwing the bare minimum at it. So it's like, it doesn't really seem fair. And the debt to income ratio, again, if we're coming out with, 100, 150, $200,000 worth of student loan debt, in theory, it would be nice to keep your debt to income ratio around a 1. That seems manageable. So, we have about $100,000 worth of debt and we're making about $100,000. That's your 1-to-1 ratio, right? Not terrible, maybe manageable. However, that's not the case. We're hearing that, people from PT school are graduating with 125, 150, 200,000, if not more, in student loan debt. So that is not going to cut it, especially if they're coming out as new grads and making 65, 75,000 a year. It's just not fair. And so I think we've got to start having these conversations and getting the ball rolling about, all right, well, where do we start? Right. So let's kind of dive into that a bit. Let's talk about that and really going back to the financial literacy piece. Where do we start with that? I mean, I know where I think we should start, but if you're in PT school, it's a little late for you at that point. So where do you think we start? And then we'll get into the how.
So I'm gonna press you on that a little bit because I think that I may see things a little bit differently on that front. So I did graduate with over $200,000 in debt and am close to being on the end of that journey. So it's been a challenging journey to say the least, but has been possible essentially in less than my 10-year time frame. And in some of the studies that I've done, I did a qualitative study looking at the experiences of physical therapists with student loan debt. And in some of those experiences, many students were able to pay, many graduates were able to pay off their loans in much faster than would be expected. And part of that reason is because of these multifactorial situations. So in my case, I am in a dual income household and where my partner didn't have loans. So that was extremely helpful and was helpful in some of the other stories I've heard. And in addition, I think that entry level salary is accurate, right? I came out of school. My initial job was pay per visit pediatrics. So I didn't last more than 4 months because it wasn't paying my bills. But if I had, who knows what, maybe less than $50,000 in an annual salary. However, if that's your starting salary, that doesn't have to be your ending salary. So within just a short amount of years, I was able to increase that salary significantly and able to pull in side money from various things, overtime rates, PRN rates, contract situations. There are ways to do it. And I would say that my personal financial literacy education came about after PT school, and I was still able to utilize that to make it work. I think if we start it too early, I think there was a conversation at our presentation where, it was like day one PT school, you set the numbers in front of students. I think there's a real concern with that because if you compare numbers to PT and almost any other career, it's not going to pan out, right? It's the math isn't there, but we didn't get into this career to make the most money. We all would have chosen something different. And so we have to look at the value of the profession and the career in more than just debt to income. And yes, we have to work on this problem, but we also have to think about we need PTs, we need OTs and vets and all these other professions that are in the same debt to income situation. So how do we show the value, not just monetarily, but for what that brings to your career, what that brings to your life, and how then do you make the finance work? That's kind of my own soapbox.
Yeah. No, I love that take. I mean, again, for me, and this is just personal experience, I wish I had learned more in high school about debt in general, credit cards, right? Interest rates, buying a house, buying a car, right? Getting a salary, what taxes, right? Benefits, all of that stuff. I wish I had learned more about it earlier on. I don't know that it would have necessarily changed my decision to become a physical therapist. I think it would have changed the way that I go about it, right? The way that I went about it. I was from New York originally. I left New York to go to a private school down in North Carolina. From there, I went to a state school for PT when it was a master's program, and then a private school for the transitional doctorate, and then a private school for the EDD. So It was a weird journey. I bounced around a little bit, and had some good situations. I was able to pay off my master's while I worked through school. I was not able to pay off all the undergrad and then some of the TDPT and the EDD. So I'm still working on that. But at the end of the day, I feel like, yes, we need to do a better job educating on financial literacy just in general as a country, right? But then B, I think you did a very good job of, even if it's after you graduate, you're like, okay, now I graduated. I have this student loan debt. I'm taking responsibility for it and I'm just going to figure it out. Right. Which is a great approach, I think. I think that really wakes people up a little bit and gets them to dig their heels in and figure it out. The great thing, and you did this as well, I did it too. As soon as I graduated, I bounced around to a bunch of different settings to kind of find that happy medium of what I enjoyed and what I love doing, right? Which is weird because I was an outpatient ortho bro for life, right? I was going to be the New York Mets physical therapist. That was my goal. And then, life kind of got in the way, threw me some curves, and I had some opportunities to climb up the financial ladder of salary. And I followed it. Each job I left and I went to had better salary, better salary, better salary. And then at some point I was like, I'm making more, but I'm not happy in this setting. Like I did not enjoy this. And eventually I got into skilled nursing facility a little bit. I got into home health. I did travel therapy right out of the gate for a year. That was awesome. In hindsight, I probably would have gone back to that if I didn't get married and have kids and do that whole thing. So, but there are options out there, right? Travel therapy pays very well. Home health pays very well. Now you have to, be able to stay on top of your documentation and make it make sense. But there are settings out there that will pay more, and it's dependent on the location, it's dependent on the setting, right? Because at the end of the day, any business has to have a bottom line or a ceiling, if you will, that they can offer you before they're not making money anymore, and then it doesn't make sense to keep you, right? So I think the one caveat there is, yeah, I found a job eventually in a setting that I really liked that paid very well. Then the next option was, all right, if I was taking any sort of pay cut, to find that happiness, the PRN and the weekend gigs and stuff like that are a good option. They pay very well as well, but you're still having to trade that time for money, right? You're having to go in on the weekends, you're having to be there, you're having to physically trade your time and your skill set for money. Which is why, again, I started looking at other options then because I was like, I don't want to work for somebody all day, every day. Like, I can't, I'm becoming unemployable at this rate. Like, there's just so many better ways to do it. I want to do it a different way. I want to do it my way. And that's when I kind of dove into entrepreneurship and I kind of started my own business, which, has now stemmed into 2 or 3 different businesses that all kind of help, pay down the loans little by little here and there. And, you get some pretty decent tax breaks as well owning a business. So that's been helpful. And at the end of the day, I kind of took the same approach as you did. Like, hey, I'm taking full ownership for these loans. I took them out. I'm going to figure out a way to pay them off, and it can be tough. It can be a shock to the system a little bit when you realize, holy cow, I have, over $100,000 in student loan debt and I got to, come up with payments every month. But some good financial planning and talking with somebody, especially a financial planner who specializes in student loans, can really help you find which repayment program is best for you and your plan and what you're trying to accomplish in life. And then from there, figure out, okay, I got the payment plan. Now, how do I pay it off? How do I make the money to come up with that? So, different strokes for different folks, for sure. There's different ways to accomplish the goal of paying off the student loans. But what are some options that you see out there? Maybe some outside the box things and some things that you've seen in academia or beyond that you think are going to help matters a little bit.
Well, I think the biggest thing that I found coming out of school was that I understood how interest worked and the amount of money I would pay back, and I understood that I would be able to get a job. I understood the different settings from a clinical perspective, but what is not really taught is how the finances vary per setting and what that means for how you choose a job. And so we've created some financial literacy workshops for our own students. And then what it really focuses on is how you make money in different settings. So what it means to have a salary position, an hourly position, and what that means for your ability to make overtime, et cetera. So when I was first starting out, I took this pay-per-visit pediatric job, which I loved, and didn't make any money and had to move pretty quickly away from that job just to get started on my loans. And I worked in an hourly outpatient clinic where I had set 40 hours. And then I was attached to a hospital. So I was able to work overtime on the weekends in that hospital, which was a much better rate than any PRN rate in our area because it was time and a half versus in Austin, Texas, the PRN rates are fairly low because it is a pretty saturated area. And so I was able to really capitalize on that overtime rate, and nobody else wanted to work the weekends. So I just worked, well, almost every weekend or every other weekend. That was able to chunk away really quickly at those loans. So I think that's, of course, there are loan forgiveness options, especially if you work for nonprofit sectors. But if you want to pay off your loans without going that route, you really should do it quickly in terms of if you don't want to spend that much money over time. And so that really helped initially. I did that for almost 3.5 years. And then I had to change jobs when I had children because my outpatient position did not allow me to get my children for daycare. And so that's, I think, another thing that there are a lot of people in this space, but they may not see this from a perspective of a mom. And so that was something I wanted to. That's sort of one of the reasons I like to be out here and talking about this because those were issues that I had to deal with that other people did not talk about. And so that's where home health really came in because I was able to make a lot more per visit than any other position. And I was able to do so with flexibility to make it to appointments and things like that. So I did that for the next 2 years in geriatrics and pediatrics. That really helped even get into academia because I was able to then start teaching as well because I had this flexible sort of not full time um, pay per visit home health position. So I think part of it is understanding how those payment system works and then considering as your life changes a lot because it's going to take some amount of years. The fact is I've seen people pay off these large chunks of loans at like 3 to 5 years, right? Even $150,000 can be done if you make sort of the right decisions and you have other support, especially if you have another person in your household. But it's still going to take some time. So you may have to adjust your strategy over that time period to accommodate what happens with your life.
Yeah, I think you bring up some really good points there, right? One, it's not always about the salary. And like I said, I've taken many jobs up the ladder that just was more salary, but it didn't make me happy, right? So if you can find a job that maybe is a good setting for you, that you're happy in, that you love, and there is a price differential, then like you said, maybe we find a way to supplement that difference just so that you're happy, right? The flexibility is huge too, right? Whether or not you want to become an entrepreneur and start your own business, you still at least have to have a little bit of business acumen and know how the payment systems work, what business looks like, what a good contract looks like, what red flags to look out for, right? You have to know how to bring value to a system to show them, hey, I'm worth more than, competitor B or whatever, right? So I think having the business acumen to at least know how business works is especially important after you graduate, right? And I think one of the ways that I try to do that is I kind of weave it into the curriculum, especially in our PCM2 course, which talks a lot about different settings, and then our geriatrics course, which same thing talks about a bunch of different settings. I'm able to kind of explain, hey, I've worked in this setting. Here's how this works. Here's how this works. And it's not everybody can say that or do that, right? You and I are very, very distinct in that we have a bunch of different experience under our belts. So we've seen a lot and we know what worked for us and what didn't. So, what might be right for us may not be right for someone else, but at least we can present all the options and say, hey, here's some different things out there to consider. And the flexibility, like you said, with home health was phenomenal. Making your own schedule, being able to pick the kids up, do that whole thing. That made me happy. That was, it was nice to be able to flex that schedule around and really, be there for the kids as they were growing up, so that was super important to me too. But also you bring up a good point about like, okay, people are taking this option of trying to just pay down huge chunks of debt and just throwing big chunks at it as quick as they can and trying to get down to no debt in 3 to 5 years or so. And again, that can definitely work for some people, especially if that's the goal, but you also don't want to burn out. You don't want to overdo it. You don't want to, be working 7 days a week for 28 days straight. And then you get to the end of the month and there's no gas left in the tank. You just can't take it anymore. So you got to know yourself. I think you got to know what you can handle, what you can't, what you like and what you don't. So I think that again, that's where the entrepreneur road kind of helped me out because it was like, yeah, I could work PRN on weekends for someone else, or I could see my own patients, cash pay and make probably double or triple what I was making at a PRN, making somebody else rich, and I'll just work for myself, and so that really kind of, got me excited to kind of venture into, business and whatnot. But I will say that it wasn't easy. I mean, PRN and going in and working all those hours, learning a new documentation system, being the only one there every weekend, like having to do the documentation, that's not easy. Starting your own business, seeing your own patients, having to do the books and the taxes and all that, it's not easy. So they're both hard. You just got to pick your hard. You got to pick the direction that you want to go in. And again, it's a lot about just self-awareness and knowing what you can and can't handle. But I do like the idea of, again, weaving options into academia. And I love the idea, again, of having the webinar type setup or, a financial literacy course for our students as they kind of progress through the program so they can kind of see what they're going to be up against. What else are you seeing out there? What are some different things that you've seen? I know, we kind of talked about in a conversation at our presentation about the DPT and, different models that may or may not be working and things that we probably could have done in hindsight. We can talk a little bit about that nursing program and how you can get in and out at different levels, and that's one of the things I preach to my kids, and I hope they'll listen. Go to community college for 2 years, go to a state school for 2 years. If you still want to go to grad school, I'll pay for it at that point because we'll have enough money for that. But find the cheapest route, get the best grades you can along that route, try things out, see what you like. And then, once we've exhausted all that and you've graduated, then we can talk about the next step. But yeah, I kind of did it backwards. It wasn't wasn't the right way to go about it in hindsight. But what are some different models and methods that you're seeing out there that we kind of chatted about at the conference?
I will get to that, but I did want to talk about the burnout piece
Yeah, please.
because
That's a big one.
I think that that's important. And in the research that I've done, I've kind of seen that people that have chosen to do this really quick payoff, so like the 3 to 5 payoff, whether it's $80,000 in 3 years or $150,000 in 4 years, or these large chunks, is that at least at the end of the journey, like when they're done, they describe it negatively going through it, right? It was hard. I worked weekends. I lost my social life, that type of thing. And then it's temporary, right? Then they get out of it and they go forward. And then they also have this feeling of accomplishment that they did this thing. And so I think that if you're in the midst of it and you're 2 years in and you see no end and it's not working out, then there's a huge risk of burnout. And then we'll lose great therapists 2 years into um, their career, which I think is a problem. But I think that if we had better options, more education, and more support, right? When I came out, I had older therapists say things like, I can't imagine having that much debt. Instead of being like, let's figure out how we can make this work. Let's advocate for better reimbursement. Let's see how we can bring you into this profession. I think that that would go a long way. And that's kind of why I'm really excited about doing this work, because I think that if more people can see ways that it's possible, they're not going to feel like that burnout as much. And so that's one thing. I think there is room to improve the way that we structure education. I think that, the nursing model where you can get a bachelor's in nursing, you can get a master's, you can get a doctorate, you can get a nurse practitioner. There's various degrees that you can get. Whereas DPT, we've just said this is your first option, and it's a really expensive long-term option that if we went back and said, okay, you could get a master's or a doctorate, you get a master and then build to a doctorate, would be helpful to give more options. But I also think there's areas for improvement in how we structure things like clinical education. So if you look at our speech language pathologist friends, right, they do 2 years in school and then they do this residency type year, and I'm probably calling it the wrong thing. But they're out there and they're making some amount of money. They're working under someone. I think that there's hesitancy to do that because it would change so many structures. It would change the whole clinical education. It would take my job away, right? Like it would do all of these things. But really, the cost of clinical education, that's our biggest complaint in clinical education, is how much money, even or in the flex program, our students are able to work. Some of them work full time. some of them work and pay off most of their tuition, even in regular work. And then they get to these clinicals and they have to put everything on hold for 6 weeks, then 12 weeks, and another 12 weeks. And that system doesn't really make sense, right? And it's the clinics are oftentimes utilizing students in ways that are not appropriate from an educational standpoint. And so what if we change that whole structure and that we had a 2-year program and then students went out on these residency type experiences and made some amount of money, a less amount of money while they were still being educated and brought up. And maybe that would lead to additional fellowships or residencies where they could then get those specialist certifications in a 4th year or something like that. But it's time to start to revisit how we're doing things for the longevity of this
Yeah.
profession.
I mean, again, like we talked about that nursing program, right? It even starts at an associate's degree, which we could have started with a PTA degree and associate's degree, right? Gone up to a bachelor's in movement science and or physical therapy, then the master's, and then instead of the DPT, the next jump would be the PhD, which would also help with the CAPT credentialing that currently they're wanting 50% of faculty to have a terminal degree, but they're not counting the DPT as a terminal degree. So it kind of seems like they painted us into the corner and now they want us to get out of it. It's like, well, good luck, everybody. So I think that could have helped things. I think obviously, like we said, it's maybe a little too late now to kind of look back in hindsight. So we've got to figure it out. We've got to, brainstorm other options. And I hope that this episode again will spark some conversation on the social media front. And we'll have, some conversations with some ideas. I had posted an idea a couple of months ago on Twitter about almost like an army program where, much like the residency, you come in for 2 years, but the university has an on-campus biosphere of, outpatient, inpatient, neuro, whatever, right? And their 3rd year is a paid residency, right? That helps pay down their first 2 years. And then they owe 2 years to the university where they get paid full time. If they want to go and do a fellowship or something while they're there for that 2nd or 3rd year or whatever it may be, that they could do that as well. But the university makes its money, not with a high tuition rate, but instead with the money that it's getting from the patients that are coming in to see us, so it's like its own self-sustaining, self-sufficient healthcare system within like a teaching hospital, and caught a lot of flack for that one. That didn't go over as well as I thought it might. But
What was the criticism?
uh reimbursement wasn't going to be enough to cover the difference in tuition. Like I said, what if we just made a flat rate, $5,000 a year for everybody who gets into this program, right? That's their tuition. So they graduate with $10,000 a year worth of debt, or $10,000 total. Then the university makes the money to pay everybody that needs to be paid in the academic side through the patient care stuff, right? And we siphon off some of that. And again, maybe it's grants, right? Maybe it's state funded or federal funded. I don't know. I didn't go that far down the rabbit hole, but the moral of the story was they didn't think there was going to be enough money through reimbursement to pay for everything that needed to be paid for in the difference in tuition. Okay, that's fair enough. Though, then why can't we find a sweet spot, a Goldilocks zone that this is the amount that they'd have to pay bare minimum for tuition, and then everything else will be supported? And again, you're paying that first year out on a residency less, so they wouldn't be making a full therapist salary, so would recoup some money there, right? Maybe they go through a residency or something, and then that 3rd or 4th year they end up doing maybe a fellowship or something. And if they don't like the residency they picked, they could do another residency on that 4th year, or a fellowship and something different. Like, we're all still there. We're all still in the sandbox, so they can pick something else. We're not trying to force them into something right out of the gate that they don't know if they're going to like or not. Maybe they do like it and maybe they don't, but they would have another opportunity in that 4th year to find a different specialty if they didn't like the one they were in, so.
Well, I think that criticism of reimbursement really hits on one of the major problems. I mean, I think at every conversation, every podcast I've ever heard about student loan debt, it's, the cost of education. Well, it costs money to put on a program, and it costs money for equipment, it costs money for faculty and staff. And in one of the interviews I did for my qualitative study on experiences of a physical therapist with student loan debt, one of the participants touched on this unprompted, and was basically this person also worked in academia, and they say, I, we're doing all these things. We're cutting fees. We're changing lab hours, and to what purpose? Like the students are then missing out on educational opportunities, and they're still coming out of school with all this debt because things cost more money now. Like everything we do is going to cost more money. And what's the real problem is we've seen no increase in reimbursement. We continue to see Medicare cuts. And part of this problem is if you look at the people that are voting for Medicare cuts, none of them have ever worked in physical therapy or occupational therapy or speech therapy. None of them are these types of professionals. We may have a few, elected officials that are doctors or
Yeah.
physicians,
Yeah.
maybe a couple nurses.
But they
And so
don't.
I want to
Yeah.
go to the floor of the Senate and say, how many of you have been in a Medicare or Medicare recipient's home? None,
Yeah.
right? So, well, they all only receive Medicare, but
Right.
how many of you have seen these patients and know what it's like and understand the work that we do? And the answer is very few. And so if that doesn't change, then we can cut costs of education, we can change our system and get nowhere. We really need to find ways to effectively advocate and do research associated with showing the value of our services and demand that we get paid more for them.
Yeah, I think that was a common theme in a lot of these type of presentations is that until we get viewed as primary care practitioners, we're not going to get reimbursed at that level, right? So we've got to start doing the work and the advocacy to kind of level that up to get the appropriate value of what we're worth when we're getting reimbursed, right? And I think too, like when talking about even like student loans and then comparing it to what it takes to run a school, right? Or a system, you can budget and cut and cut and cut. But at the very end of the day, there's only so many cuts you can make, right? Cutting out a Starbucks coffee every day isn't going to help you pay off your student loans. Yeah, it's part of budgeting, but there's not enough coffee to cut out to make up the money to make the student loan payments. So again, I think we've got to look at the other end. We've got to be paid more, right? We've got to increase income. We've got to increase salary. So whether that's through higher reimbursement rates or whether it's through starting your own business and removing the ceiling from how much you can make, that's the side of the spectrum I think we need to focus on. The cuts.
I really do think it has to be, sorry, I think
No,
it has to
please.
be reimbursement. And I think entrepreneurship is a great option. What I see a lot of is that unless you're incorporating some sort of pro bono situation in your entrepreneurship, then we're leaving out an entire population of people that are not going to get the care that need to be had. So yes, that is a solution for individuals to pay off their loans and to make more money. But from a societal standpoint, if we are able to provide services and being reimbursed for those services through our governmental systems, through our health insurance systems, to provide care for more people, we will be saving money for our healthcare system in general. We just haven't done the research to show that. We haven't done the advocacy to enable that. And so I get nervous when when I'm on social media and I just see so many people just like leaving the system to enter into cash pay, right? Because that is, you're going to make more in cash pay, right? But what are we not doing then when we're not serving these people that can't pay cash pay?
Right.
And so that's my little.
Yeah, no, you're absolutely right. It's a story of the haves versus the have-nots for sure, right? But I think there's also another side to that coin where if you can make more money and get time freedom and financial freedom, then you can treat pro bono at your leisure. So if you're making enough money seeing the people you are seeing, then you can take time out to see the pro bono folks, right? But you've got to get to that point some way, shape, or form in order to be able to do that. And it is part of our practice act that we need to be doing pro bono work, right? That's in our practice act. So and again, my dissertation was service-based learning, so I'm all for it. I think we should be doing more, community service-based stuff and more pro bono work for sure. But again, I'm finding now more and more, now that I'm on the other side of things in academia, there are grants, there are things you can do. There are, ways to generate money, like you said, federal programs that can help those people that need it. We just need, more support and more advocacy. And like I said, I'm not a shirt and tie guy, go up to DC, shake hands, kiss babies. That's not me. But there are people that are that person, and I want to support the heck out of them and elevate them and spotlight them and put the megaphone out there and raise their voice, because they're the ones doing the hard work. They're the ones doing all the work that, I just don't think I could handle. That's not my thing, So luckily there are people that's their thing and they're passionate about it. And again, I just think we need to do more support of them and make our PAC donations. And again, I've been an APTA member for got to be close to 20 years now. I have my issues with the APTA for sure. I teach the APTA in our PTP1 class, and I give the pros and the cons. But at the end of the day, I'm still a member because I feel like it's the right thing to do. And it's going to support the people that are passionate about stuff like this and can get things done and network with the right people and make the right calls. So that's another little random rabbit hole we don't need to go down tonight. But it's been an absolute pleasure talking with you, Madeline. And tell me a little bit about if you could give like one takeaway message, one like ray of hope, one thing that you want people with student loan debt to think about. What would that one thing be?
I still think it's just the best profession in the world. I think we have the coolest job that we get to see and work with a diverse population, and there's so many avenues to go in. And I just think that if you're in it, like if you're in the loan payoff, then just keep going, right? Because it's still so cool. And I like, even though there's so many problems, like it is the coolest profession in the world.
Yeah, I put my head on the pillow every night feeling pretty good about myself, knowing that either I treated some people and it helped them get better, or I taught and molded minds that are going to go out and treat people, So, yeah, I love it. I enjoy it. I think just like any job, it's what you make of it. It's how you leverage your knowledge and your skill sets. And really, luckily, physical therapy has so many avenues that if you're just not really happy in one, find another. If you're not happy in that one, find another. There's a bunch of them, I promise. Right? There's 8 to 10 different specialties at this point, 10 to 12 maybe. I don't know how many we're up to, but it's growing. So there's plenty out there, plenty of settings, plenty of specialties, plenty of populations, plenty of people that need our help. So yeah, at the end of the day, you can feel pretty good about it. But we've got one last question that we ask all of our guests. And that question is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it?
I will give us back subsidized loans for graduate education.
Yeah, I like that. That's short, sweet, simple, to the point, and it helps out, right? It's going to stop these, I don't want to call them predatory loans, but like, big loans from snowballing out of control because of our interest rates and just the ridiculousness that is becoming these student loan debts. So, I think that's a good way to kind of curb things and really get us to a nice level that we can handle and that everybody's pretty happy about. So yeah, if those of you are listening out there and you want to advocate for that, please talk to the right people, talk to the House of Delegates, talk to your local lawmakers. Those are the people who are going to help figure this thing out. So thank you for that. It's been an absolute pleasure chatting with you, Madeline. Tell us a little bit about where people can find you online if they want to follow up or have any other questions for you.
Oh, I'm mostly on Instagram at Madeline Ratosia.
Awesome. We'll throw that link in the show notes so everybody can find you very easily. Madeline, have a wonderful evening. Thank you so much for your time and for coming on here and having the conversation tonight and even playing devil's advocate a little bit and taking the other side of the coin. I appreciate that conversation.
All right. Thank you so much.